portal, and I'm really excited to
I think we lost Dr. Steinbushel, so let's just wait 1 minute and let her get back on, see if she can join us again.
Hi there. I'm really excited to introduce our speakers today. Dr. Bradley Zicherman joins us from Stanford, where he pursues his interest in substance use disorders. And Dr. Juan Lopez is an adolescent medicine fellow here at UCSF. And with that, I will turn it over to our speakers. Thank you.
Thank you for the introduction and having us. I'm going to start sharing some slides here. Can everyone hear me? Okay. So today we're going to be going over clinical considerations for screen addictions and some skills for clinicians. Juan and I, we do not have any conflicts to disclose. These are the objectives that we have. We want to go over the latest data trends on social media use and screen time. We want to go over the potential consequences of excessive screen time and social media use. We will be going over current guidelines for screen time and social media use. And then we'll go over helpful strategies and how you can minimize your screen time and social media use. And then hopefully we'll have a good Q&A at the end. I've given a presentation like this several times now, and it's usually pretty Q&A heavy. So there should be around 20 minutes, maybe a little more of time for Q&A at the end. I like starting with this slide. Where do people spend more time on social media? I think it's just really interesting to get a feel for what the trends are just throughout the world. You can try and imagine for yourselves why maybe Japan is at the bottom, the Philippines are at the top. I don't quite know exactly why you might have such differences in trends, but it's interesting just to see that the Philippines might be at the top, where they might average 4 hours of time on social media per day, whereas in Japan it's only 45 minutes. And then the USA falls somewhere in the middle there. This data was from just before the pandemic, so I believe it came out around early 2019, very early 2019. So you can imagine that these numbers are probably even higher now. All right, so on average, how many times per day do you think you actually pick up your phone? Anyone want to take a guess at that and maybe type an answer in the chat or a thought in the chat? All right, so 100 plus. Any other guesses? 100 for sure. All right. Anyone else want to take a guess at this? All right, so we have 2 votes for 100 plus. What is it actually? It's actually a little bit less than you might think. On average, we pick up our phones about 58 times per day. 70% of those sessions are less than 2 minutes. 25% of those sessions are around 2 to 10 minutes. And then 5% of those sessions are more than 10 minutes. And that time tends to add up to around 3 hours and 15 minutes. Again, this data actually came out just before the pandemic. So I imagine these numbers have shifted, and maybe it is a little bit closer to 100 now, but it's at least 58, I think you can say safely so at this point, probably a little bit higher. So just some interesting data points. Adolescents aged 13 to 17 spend an average of almost 9 hours per day using screen media. 88% of adolescents own a desktop or laptop computer, and 95% own a smartphone. 45% of adolescents say they are online almost constantly. 54% of adolescents say they spend too much time on their cell phone. And 65% of parents worry about their teens spending too much time in front of screens. Again, the interesting thing is this data came out just before the pandemic. So you can imagine these numbers have probably shifted even higher percentages. And this information comes from Common Sense Media. If you're not familiar with Common Sense Media, they are an organization that's actually based out of the Bay Area. I think it'll be really interesting to sort of see the data when they release sort of an update to this information.
So we're going to just talk a little bit about some of the data points that came out early in the pandemic. With Verizon, US video game usage was noted to have gone up about 75% since quarantine had first gone into effect. And these are peak hours during the early evening and the late afternoon. Video streaming services had gone up about 12%. And then overall web traffic went up by a fifth, which was pretty substantial. And then pretty recently published data from November 2021 out of UCSF from Dr. Zicherman Dr's work was looking at US adolescents screen time use during COVID-19 and some of the findings from the ABCD study, or Adolescent Brain Cognitive Development Study. What they found was pretty alarming. They were looking at 12 to 13-year-olds with self-reported data across about 5,000 individuals, 5,400 individuals. And screen time use for non-school related services went up nearly double, pretty much double, 7.7 hours per day as compared to pre-pandemic rates. They also found that the most common utilization of screen time was for watching and streaming services, less so with video games, which was a bit surprising to me. And then they also found that children of color and those from lower income families were logging more hours with screen time use compared to white and wealthier peers, and that there was a correlation with poorer mental health and perceived stress with total screen time use when it was higher. So we can go to the next slide. And now we're just gonna discuss a little bit about some of the consequences for excessive social media use. The first, we can go to the next slide. The first piece that we wanted to touch on is some research that came out from LSU and Tulane back in 2017, which was looking at an association between screen time and depression amongst US adults. And this was in the Journal of Preventive Medicine. And this was pulled, they were using data from NHANES, from the National Health and Nutritional Examination Survey, stuff that CDC uses. And this is for 3,200 adults with self-reported PHQ-9s and self-reported hours of using TV and computer. And what they found was that there was moderate to severe depression levels that were significantly associated with higher time spent watching TV or using the computer. And what they defined significant was more than 6 hours per day. Now, they were making some important associations with a sedentary lifestyle, also increasing the risk for depression. And they were adding to prior evidence from research from 2010 and 2015 that was looking at more than 4 hours per day of TV and computer use as already being shown to be associated with increased risk for developing depression. Now, the second article here, the adolescent social media use is positively correlated with depressive symptoms. This is a meta-analysis that came out in 2020 out of the University of Oregon. And they actually commented that there was a small but a significant positive correlation between the use of social media and depressive symptoms, but that there was a lot of heterogeneity amongst the studies that they were looking at and a lot of confounders. And so one of the things that they commented on is that there could be potential benefits to social media use in adolescence, such as better reported self-esteem and perceived social support, and that there's a multitude of contradictory data citing both positive and negative impacts of social media. And what they were recommending for going forward is that future research may want to look at what types of screen and social media use are harmful, which types may be helpful, so that organizations or agencies can make more definitive or stronger recommendations about how to moderate social media use. So we can go to the next slide. And social media use in adolescence was found to be associated with poor sleep quality, anxiety, depression, and low self-esteem. This was from researchers out of the University of Glasgow, published in 2016. And they had surveyed about 467 Scottish adolescents. What they found was that nighttime specific social media use was predicting poor sleep quality after they had already controlled for anxiety, depression, and low self-esteem. And what they talk about in the article that I think is important is that compared to just general screen time, like browsing the internet or watching TV, social media can impact sleep more because of at least two reasons. And so the first was that there's alerts, the incoming alerts at night, and they found that 86% of the participants in the study had slept with their phone in their bedroom, often under their pillow or in their hand. And a quarter of all the respondents had sleep interruptions from incoming texts and social media alerts. And then the second was FOMO, or fear of missing out. And they noted that young people find that there's considerable pressure to be available 24/7, and that young people are struggling to relax at bedtime due to the anxiety of missing out on new messages or new content that's on a social media platform. We can go to the next slide. And so what are the consequences of excessive screen time use? I mean, this is longstanding physical health impacts that I'm sure a lot of us are already fairly aware of. But these are all more or less like looping back to the sedentary lifestyle impact, is that there are correlates with pediatric and adult obesity, heart disease, thromboembolic events, pain in the neck, the back, the lower back, tendinitis, and carpal tunnel syndrome. Two of the articles here that we're citing is one from Chinese CDC research from 2019 from their meta-analyses that was looking at screen time as being a really clear risk factor for developing obesity due to the lack of physical activity and the associated increased caloric input as compared to energy outputs. And then the second was some research that came out of Stanford from our pediatrics department. And this was in the journal Pediatrics back in 2017. And what they found was that there were three at least distinct mechanisms for increased obesity risk with using screen times in adolescents and the pediatric population. The first is, yes, it displaces physical activity. The second is that it's reducing sleep. Later bedtimes and less total sleep time were found with teens using screen times. And this sleep deprivation was linked with increased appetite and decreased satiety due to some dysregulation that can happen with appetite regulating hormones, things like leptin and ghrelin. And then the third is that they found that children who consume screen media are also consuming fewer fruits and vegetables and more energy-dense snacks, more energy-dense drinks, fast food, and that they're having a higher total energy intake overall. So we can go to the next slide. So this is like pretty recent stuff that came out back in September of this past year. There was a pretty groundbreaking article that Wall Street Journal published called Facebook Knows Instagram is Toxic for Teen Girls, accompanying documents show. And for anyone who hasn't read it, I highly recommend it. Effectively was kind of shining a spotlight that Facebook has been conducting internal research and had an internal Instagram report back in March of 2020 from about 3 to 4 years of research that there has been pressure for teenage users, but especially teenage girls, to look perfect, to share only the most positive and polished parts of their lives, and how the addictive nature of the app of Instagram can lead to increased risk for eating disorders and depression. And it also spoke about how Facebook has really made minimal efforts to address these issues and has played them down in the public. And it noted that 32% of teen girls have found that whenever they use Instagram, it made them feel worse about their body and their self-image, and that there was a serious detrimental impact with the phenomena of social comparison that really appears to be very prominent and prevalent with Instagram. Interestingly enough, there's a lot of bipartisan support to tackle this issue with Facebook, or now Meta, and social media's impact on the mental health of US teens. Facebook's response, or Meta's response at this point, is that they are actively looking and researching into ways to pull teen users away from dwelling on certain types of Instagram posts and trying to nudge them into more, what they quote, uplifting and inspiring material. And separately, the Royal Society for Public Health, it's a public health organization based out of the UK, they published a report back in 2017, so this is pre-pandemic as well, called #Status of Mind. And they were looking at all the positive and negative effects of social media on young people. And they surveyed 1,500 folks across the UK, and they found that YouTube was actually the most positive in terms of like a potential positive impact that it could have, versus Instagram and Snapchat being noted to be the most detrimental. And so they recommended 3 priority changes. The first was to introduce a pop-up whenever there's heavy usage of social media on a certain platform. The second was social media platforms should be held responsible to identify individuals who might be suffering from mental health problems based on their posts, and then to help support them. And the third is that social media should highlight whenever photos of people have been digitally manipulated, because that was also cited as one of the concerns with the comparison piece, especially for teenage girls. We can go to the next slide. And so the last article that I wanted to just mention, this is a 2019 study out of the Journal of Nutrition and Dietetics from Monash University in Australia. And it was a systematic review looking at the impact of habitual, regular social media use on body image and food choices in young adults aged 18 to 30. And what they highlighted were 5 themes. The first was that social media really does encourage comparison between users. The second is that these comparisons really can heighten feelings about an individual's body shape, body image, and self-worth. Number 3, that young adults will modify their appearance to portray a perceived ideal image. Number 4, that young adults are actually aware of the impact that social media has on their body image and their food choices. And the last is that there's a lot of external validation via social media that's actively being pursued by users of these platforms. And so they found a really important correlation that social media engagement is associated with higher levels of body dissatisfaction, dieting, restricting, and even orthorexia, the unhealthy focus of eating in a healthy way. They couldn't determine causation and longer-term eating behaviors, but something that's been really important is the work that I do at Stanford's eating disorder program is we're finding increasing rates of teenagers citing TikTok and Instagram and Snapchat as key sources for stress, for them to receive information about disordered eating, dieting, or exercise. So I'll pass it back to you, Dr. Zicherman.
All right, so these are the current screen time recommendations from the American Academy of Pediatrics. They are at this time recommending no screen time for babies up to 18 months, other than for video chatting. from the age of 18 to 24 months, use only high quality media sources and supervise your child's usage. From age 2 to 5, children should spend no more than an hour a day on a device. And then for older youth, parents are encouraged to develop personalized media use plans. And then the AAP has also added that children should not sleep with devices in their bedrooms. I think, I don't know if I want to say that the AAP sort of punted on this issue when they say for older youth, parents are encouraged to develop personalized media use plans. But I think we're at the point, or I think it'd be really helpful for the AAP to actually come up with some sort of concrete or just more detailed recommendation for older youth, considering the mounting evidence that we have that different kinds of screen time. You can say screen time in general, sure, but also just that certain specific kinds of screen time are really detrimental to use when the hours are accumulating. So what are some strategies to minimize screen time and social media use? I try and go over all of these and work with parents and patients on all of these points. The first bullet point, set up screen-free zones. I will mention this to all the families I work with. I've had varying levels of success with this one, but I do have some families who have actually tried to do this, to set up screen-free zones, and it has been an effective measure with those families. And then the idea of designating screen times. The idea to turn off all media devices beginning at least 1 hour before bedtime and keep them off during the night. This is a recommendation that I'm very firm with when I meet with families, teenagers, even adults. If I have adults that are having issues with screen time, I will actually even push it to 2 hours and say, consider even turning off all screens beginning. 1 second. I just activated my Siri by accident there. Apologies. So 2 hours before bedtime is what I will actually often recommend. And when I have families that actually work with their younger children to at younger ages to come up with a concrete time that, say, every day might be their actual time to use a screen. Say it's maybe 3 p.m. when they just get home from school, and say at 3 p.m. this is your time until 4 p.m. This is your window to use screen time. You can use it however you like. When I have families that are willing to implement measures like that, I think there's a lot more success down the road that you'll see as children age into adolescence and young adults. Then the idea of balancing online and offline activities. This is another point that I bring up in most of the sessions I have with families regarding screen time. The idea of coming up with pro-social activities, trying to find other activities and interests that are just not related to using screens. Maybe it's hiking or riding your bicycle more often, something else, that just reading, anything else that just doesn't involve the use of a screen. That's often where the dialogue with families and patients tends to go. And then, of course, you need to get enough sleep and exercise. So often I'll have patients come into the clinic that maybe they get home from school at 3 o'clock and then they're literally using their screens, playing games and social media, whatever it might be, until maybe 3, 4. Sometimes I have patients who will tell me they're up until 5 a.m. Of course, there's no time to exercise if you're doing that. And then these patients are often caught in a really poor sort of feedback loop where if they're staying up till 3, 4, 5 a.m., then they're going to be way too tired to function in school, and they might not even be attending school. So it's a really difficult cycle to break. And this is, again, more evidence and reason why it makes sense to really encourage designating screen times around bedtime and saying, please don't use your screens an hour or two before bedtime. Another strategy that I will suggest to every family teenager that I work with is the idea of it goes into setting up screen-free zones, the idea of not charging your phones and sort of portable electronics in your bedroom, and preferably not even having computers or televisions in the bedroom. Then last point here, the AAP does have a media plan. It's fine. I don't have a lot of families that have used it and told me they think it's like a great tool, but it is a tool. It's there. You can Google AAP media plan and look at it in more detail. So what are some parenting strategies to minimize screen time and social media use? It's really important to set clear boundaries and have clear expectations. Have clear agreements on screen time limits and clear expectations for other responsibilities like completing homework, bedtime routines, chores, exercise, non-technology hobbies. And I will even work with families to come up with actual written contracts, almost in a contingency management type approach. And I have actually had a lot of success working with families that way. This is also another really key point: modeling behavior. If parents of teenagers aren't willing to charge their phones outside the bedroom, if they're using their electronics right before bedtime, then their children are not going to do that. So if you want screen time behaviors to change, you really have to model those behaviors. And then the last point here, setting controls. There are apps on phones now that you can actually use to control your child, your teenager's screen use, essentially. There are some tools that are built in the phones. There are some that you can actually attach to a Wi-Fi, to a router, essentially. And they can be effective. It's usually the last measure that I will coach parents to use, as it can certainly impact bonding and relationships between parent and child, and the trust between them. So this is another question I get asked all the time: when exactly should you seek help for what feels like a screen addiction? And what I'll tell parents, other clinicians who ask me if there's a patient that could be a good potential referral, it's the idea of, is it impairing their ADLs? Do you have a patient or child, teenager who, they're not brushing their teeth like they should, they're not showering daily, their sleep, like I mentioned, the example, someone who's up until 3, 4, 5 a.m. Is that happening? Is that leading to problems in school, school attendance, school performance, grades? Is screen time, does it seem to be affecting relationships at home, with friends, peers? That's when it makes sense to potentially refer or get these individuals in some sort of treatment. I would say the majority of teenagers that I'm referred for screen addictions, they end up almost always having a dual diagnosis consideration, and end up being diagnosed with a mood or anxiety disorder. So I think that's how I would summarize essentially the question of when to seek help. I'll also say, in addition to when patients get referred to me as a psychiatrist, almost all these patients, the teenagers, they end up also benefiting from both having individual therapy and family therapy. So what are some resources that we would recommend? I did mention a little bit about technology control apps. Apple does have their own built-in program at this point. I look at this as essentially a last option because it certainly can affect trust issues within the family. And then levels of care. There have been several patients that I've worked with that is on an outpatient basis. I have not maybe been able to help to improve their functioning. Maybe, you know, that individual who's sleeping until, or sorry, they're up until 5 a.m. Maybe that person, after, you know, working with outpatient psychiatrists, therapists, individual therapists, family therapists, if it doesn't seem like they're making changes within a few weeks, then I might have a discussion about elevating them to an intensive outpatient program or a residential program. And there are residential programs out there that, well, they might say they specialize in working with individuals with screen addictions. There's not a whole lot out there, but there are some. I think most dual diagnosis programs, though, will take these patients, and that's likely a more than adequate environment for these patients. So this is just a little bit more of a summary on some sort of preventative and educational tools, and a summary of some of the parental control tools. I do have a link here for the AAP plan, Apple support for parental controls. These are a couple of other resources that I think have some really good information. There's the Center for Internet and Technology Addiction. There is the Center on Media and Child Health. If I actually could highlight any of these resources, though, the Screenagers documentary, so it's screenagersmovie.com. It was in that actual documentary released in 2019, which is absolutely worth watching. But the website is a great tool, and the resource section is probably the best resource section that I have encountered for working with youth who have problems with screen time, addictions, or overuse. And then I want to highlight the programs that I'm involved with. So I started the Recovery Clinic. That's what we called it at Stanford. It is the Youth Dual Diagnosis Program within our Child and Adolescent Psychiatry Division. I see patients who either have substance use or behavioral addictions like screen addictions. And I would say about 30 to 40% of the referrals I get are for screen addiction at this time. So I do get a lot of screen addiction cases sent my way. And then I also do some work for the Quest Dual Diagnosis Program in El Camino Hospital in Mountain View. It is a dual diagnosis program for youth, and they do take and actually specialize in working with youth who have screen addictions. So those are just some local programs that I am involved with. And that's what we have. So hopefully there's some good questions that you have.
How do you want to field the questions? Do we need to put our hand up or something in the chat?
So I guess you can either verbally ask the questions, or you can also just ask a question in the chat.
Okay, can I verbally ask a question?
Of course.
Okay, so I'm a parent of a 14-year-old single child boy who's who's presenting with all these screen addiction things. He is sleeping at night, but So we feel that he's in this dopamine cycle and he's not interested in anything really except for the video games, which also was kind of interesting that the obesity thing didn't talk about the cortisol levels and the, the fight and flight situation that they get into with these first shooter video games is not one of the attributes to obesity, but that's another story. My question for you is, my husband's also on the line. My son's in programs, a wraparound program with therapists, and we have family therapists and so forth. And my question at this point is, for my husband and I to kind of go it alone in a sense to try and limit more of his screen time and deal with like the consequences of his addiction. Like I kind of equate it to a heroin addict who's given methadone and they're given a support system, or I've looked at residential programs where, they're completely cut off from screen, but they're also given, they have therapists every day and so on and so forth. And I guess my question being, is it possible to do this at home? And if so, if we do cold turkey, there's like explosions and upset, frankly, there's no parent that I've talked to that gets their kid off on a screen without arguments about screens all the time in every person's household that I've talked to. So my question is, is it possible for my husband and I to break his addiction in a home environment at this point? I mean, he doesn't stay up till 3 a.m, but there's school refusal going on, and literally he has no thoughts in his head but about being on the screen. And it was bad, but then of course it intensified during COVID. And also his school has him on a screen. They have to bring a Chromebook to school. He's on a screen for 7 hours, and he said all the kids are just playing video games, or they're on TikTok. I mean, and literally even PE has to bring a computer too. So how do you break an addiction to a screen, yet the child is being forced to have a screen in front of them for 7 hours a day? Did I make my question clear?
So I think the concerns you have are concerns that I see and I hear all the time in clinic. What I'll say is there are some situations and some families where you can potentially safely just remove the screens from the environment. You can say, I've had enough, like I'm just going to do this, and they're gone essentially. What you'll find in almost every situation is what we would call an extinction burst, which means things are going to get a lot worse before they get better. Of course, that can happen. Realistically, though, there are certain situations, there are certain families and teenagers where it's honestly just not safe to do that. Unless you literally sometimes have police on standby, which I have actually recommended that to some families. There are some situations where if there are safety concerns, it doesn't make sense to operate that way, essentially. You're facing a very challenging situation. I think, I'm trying to comment with a lot of generalizations here. I think my hope is that this is a problem I don't know if any of us really saw coming 5, 6, 7, 8, 9, 10 years ago. Didn't see the problems that screens might actually have for our children, our teenagers. There was, I can't remember his name, but someone on CNN recently said that they would almost rather see their child using alcohol and cannabis than screens at this point. That's how devastating they've sort of realized that screen time can be. And my hope is that we can at least increase the sort of preventative efforts at very young ages to make sure that we have situations where we don't have teenagers who react so violently to screens being taken away in the future. I think it's probably the best I can answer that.
Okay. I mean, that's kind of the dilemma. It's like, do you just take the heroin away from the heroin addict and watch them go through withdrawal without giving them help? So it's like, are you, it's like, I don't want to call the police. It's the addiction that's talking. And not that I don't want to call the police, but it's like the person needs help, not, so it's like, is it safe to do it in the home when you know that this might be a situation? And,
Right.
and then they get pushed off into this legal situation where in actuality, they need to have somebody who understands and you know what I'm saying? I don't know what to do at this, not, I don't know what to do at this point, but so that's kind of my question. And, the two outpatient or the two inpatient places in the country that do teens, they'll take them off, completely, but then they have them off for over a year. There's only two places that take teens. The rest of all the rehab places I've looked at are all for alcohol and other things, and they keep up with their schoolwork on screens. So they have screens there. The experiential schools in my area all are on screen. It's all screens.
Yeah, I think you're really speaking to one of the core issues going on currently right now, is that this is more of a very difficult to opt out scenario for all families and even for adults or youth, right? So in terms of engaging effectively within society right now, it would be fairly difficult to not have access to a certain screen. I think something that's interesting is that the research that should be, upcoming is the variation between what types of screen utilization are okay and acceptable and which ones might be more problematic. And it makes me think about other sorts of addictive processes where, for example, with eating, like it's normative, it's necessary to be eating regularly and routinely, but it can be problematic if it's restricted excessively or if there's too much all at once. And I think we're probably right now at a frontier with having to better understand, how do we really balance this? We do know that the last year was fairly detrimental because the excessive amount of screen time for youth was shown to be very, very bad. I mean, effectively, like increased rates of depression and anxiety and suicidality showing up in various emergency departments throughout the country. So this is a very difficult question to specifically answer, because it's effectively like, how do you operate within society without this, or what are you going to replace it with? And I think something for us to kind of think about is, what specifically are we talking about? Is it just the smartphone? Is it the iPad? Which app is the problem? Which video game is the problem? Because not all video games are shown to be excessively problematic, and some can be beneficial. And I think that the early intervention is a really important piece. We want to start working with families early on to try and encourage these maybe more normative behaviors of limiting screen time and screen use. Not sure if that's helpful, but it's a thought in terms of kind of the catch-22 that we're caught in right now, not just for you and your family, but it sounds like more for our society.
Thank you. Thank you.
Trying to look at some of the questions in the chat here. So one question, in fact, the first one was, screen is so embedded in our culture and associated with normalcy for adolescents. What do you share about the connection to culture and relationships? Well, I think part of the problem is that it has become so normalized. And I think the work that we're trying to do is essentially going back to a very preventative level at very young ages, so that perhaps several years down the line, when children are teenagers, that perhaps it isn't considered so normal to, be on Instagram or TikTok, whatever it might be, all the time, and just be so embedded with it. That there clearly is a lot of these social medias, they really have in a way sort of taken over, I guess, the idea of culture in a lot of ways, and what our teenagers essentially relate to and how they sort of relate to and see the world. Again, I think the idea is trying to actually break that from younger ages.
Yeah, and I think looking at some of what came out of that Wall Street Journal article, where there was an investigation about what Facebook has been doing, I think at least Republican and Democratic lawmakers are interested in trying to corral this back a little bit and try to set more regulation or oversight about how these social media platforms should be utilized, and knowing that, they are infused in our culture now. Our culture is very fluid, and so new experiences are coming in, and the youth of today are utilizing it for new forms of relating. And so I think, at least from a top-down effect, I think that will also have a big impact in terms of how powerful and ubiquitous this stuff is across our culture and globally, really. I guess the focus is for our work is more locally, regionally, and in the United States, but this is it's a global phenomenon.
Right, that there have to be some top-down changes made. And I mentioned this on the AAP slide. The AAP is a really important organization. Of course, same with ACAP, which is the Child and Adolescent Psychiatry Organization, which they essentially deferred to and use the AAP's screen recommendations. And I mentioned that I think they really need to come up with something more concrete and focus on screen time for teenagers, instead of essentially saying it's kind of up to the parent to work on an appropriate screen time plan. I think there really needs to be more of a comment on limits and what those limits might actually be, perhaps with an actual hour value associated with it. Whose lobbyists are bigger? Was that a question? Whose lobbyists are bigger will be a major factor.
I asked the embodied question, and that was mine, as you were mentioning how AAP, should take a stronger stand on these things and deciding. It's interesting as I'm listening to what you're sharing and considering what we are seeing with our uptick in mental health needs for adolescents simultaneously while screen use increased, right? And so I wonder if there will be more correlation of that out in time.
Right. I think the AAP needs to get out in front of this. ACAP needs to. You also mentioned that you wanted to clarify the definition of screen addiction. In a way, we kind of came up, Juan and I kind of came up with our own definition in a lot of ways. There isn't really a concrete definition of screen addiction out there. It was the same thing with the DSM manual. They don't really have a good DSM definition of screen addictions. They did actually punt on that. It was going to be included in DSM-5, but then they actually, I think, retracted that from the DSM-5. I think it absolutely needs to be included in, probably going to be ages until the DSM updates again, but it needs to be included in the DSM. We need to really consider this a true disorder and problem that we're seeing and facing.
Yeah, the only behavioral addictive disorder currently in DSM is for gambling disorder. And there has been a lot of discussion about internet gaming, for example, being incorporated into newer versions of DSM. I think what's interesting is that despite it not be formally something within the DSM, this is still something that we're seeing as extremely problematic and cross specialties and cross disciplines within our work, right? So to go back to the question about the correlation, I think right now we currently do have quite a bit of sizable data showing some strong correlations between excessive screen use and increased rates of mental health disorders, including even recently a huge uptick in functional tics. I don't know if people have come across that in their practices, but our functional neurological disorders clinic at Stanford, 1 in 2 new evaluations are due to what's kind of being described somewhat in the literature as a contagion with functional tics from watching other teens do these behaviors on social media. I see a hand raised. Petra.
Hi, it's Petra. Thanks so much for a really timely talk. It feels like this is such a constant question on everyone's minds. And I really appreciated your input around thinking about this developmentally and trying to set good habits with younger kids in the same ways that you would around nutrition and things like that. I wonder, if there's any value in an approach that limits screen times or makes it at least contingent on doing, certain necessary activities, including like, taking care of your basics and getting your homework done. And, that this is something that is earned, but not necessarily a given or a right.
Well, that's absolutely what I try and do and set up a system like that when I work with families. And that kind of is, I mentioned contingency management. I don't know if everyone here is familiar with contingency management, but it is kind of the idea of developing contracts. Preferably, I think working with families who are facing a lot of trouble with this, they're actually written, but can also in a way do this verbally too. It's the idea of, actually setting limits around screen time based on, have you done your chores? Have you taken out the trash? Have you done this? Is your self-care okay? The idea that, that means you can get your actual screen time that we've designated and allowed for. But then on the other hand, one thing I don't like to do is actually, I think it's important not to reward, that designated screen time with more screen time, essentially. That shouldn't be the reward in a sense. So I think it's okay to have sort of standard screen time, but I wouldn't necessarily use it as a reward if that makes sense. I think that might actually teach some negative habits.
Yeah, I have a question or a comment about that. It's like if that's now all the child is, so I feel like giving them the screen time as a reward or in correlation with any of it, basically it doesn't stop the thing at the butt of it, which is what they're always jonesing for it. So it's like, I'm only doing this because I want to get on the screen, period. That's all is the driving force, which is not, it's not a good thing. So having trying to separate it between the two doesn't seem to work either. So it's just, I kind of keep going into circles. I've read that you shouldn't give screen time as a reward because it should be a separate thing. But if that's the only thing the child's interested in, sorry, it's a plane. It's very, very difficult to figure this out. And I mean, in general, if we believe that the screen is not a good thing for him to be on, then why give it at all? But it's a very difficult, at this, I mean, I've talked to so many parents, and it's even, my son didn't even have screens until he was probably 10 years old. We didn't have screens in the house. We had no TV, nothing. And when he went to middle school, he got a phone because he was taking the bus and all this other stuff. So trying to separate those two out, I don't know how to do it. It's almost contradictory. It's like, oh, we think screens aren't good in a certain, this much excessive screen time, but guess what? You get it if you do all this stuff. it doesn't make any sense.
Yeah, you're describing really difficult, and these can be really difficult and complicated situations. And what we detail is our approach. I won't say this is all theoretical. It's not, but this all works in theory, and it works for a lot of families. But there are situations where sometimes something else might be needed. And again, I don't want to start to maybe just comment on your situation. I want to kind of focus on general advice in a lot of ways, but
Okay.
there is the idea of if we have trouble working with families, we feel like we're not getting anywhere with sort of the outpatient methods we described, then we often will recommend or escalate the care. So you do need like an IOP program or a residential program. And there are a couple of residential programs that I think you mentioned that there are very few, but there are some that will actually market themselves and focus on screen time as the dual diagnosis consideration. But my experience, I have referred quite a few patients to IOPs and residential programs around the Bay Area that have taken these patients in their dual diagnosis youth IOPs, even if maybe they traditionally focus on substance use. That's been my experience.
What's IOP?
Intensive outpatient programs.
Oh, okay. Are you able to share those recommendations or those recommended programs?
Well, I can mention some of them. Evolve is one in the Bay Area. There's Newport Academy. Discovery is another one. Muir Woods is another dual diagnosis program that I believe they will take screen addictions. That Muir Woods might not, but I know that Evolve has Discovery, and Newport's another one that I will recommend families look into.
Thank you.
Sure.
I just raised my hand because I think that would be a great idea if that was something that was available for all communities. But to send a child, 6-8 hours away to a residential facility from a rural community to an inpatient center for their screen addictions, my parents would look at me and be like, no, that's not going to happen. One of the things I've noticed with talking with a lot of families in regards to this is that there's something else going on in the relationship that is broken down in the family, and that it's not just the youth that's using the screen as their coping mechanism, but the parents have also developed their own maladaptive coping mechanisms. And so I'm curious how you work with families to be like, okay, this isn't all just the adolescent, and we can give them some type of control, and let's do the family piece also and see.
Yeah, so a lot of the work ends up delving into family therapy, but I will say, as a psychiatrist working with these patients and families, oftentimes the most important component of treatment is actually working with the family therapist. I think that's really an essential component for most of the patients that I get coming in for screen addictions. So you're right. Yeah, there is usually an issue with something within that family dynamic that might not just be working well, and family therapy is absolutely essential.
Yeah, Constance, the article or the research that came out of UCSF that was showing lower income and children of color struggling more often with increased rates, what they hypothesized, there's a lot of variables to consider here, is that due to systemic and institutional racism and disadvantages that can occur because of experienced lived poverty, and that the utilization of social media or screens can be used as a kind of an outlet for negative emotions or negative affect. And hence the reason it's probably not a very healthy coping mechanism in some ways. But again, this is so variable. Like when we screen, the irony of me saying that, but when we screen our patients to talk about what specific types of social media or screen use they are engaging with, I think it's really essential to ask what they're looking at, what kind of apps they're loading, and the relationship that they have with it. Because again, TikTok is completely different than like Reddit, which is different than certain types of gambling video games versus first-person shooters. And I think it'll only further inform us about what's going on. If the parents are also using those types of apps where they're kind of addicted per se to, you know, learning about the news. I think it's a varied topic, but I think it helps to kind of open that conversation up when we're working with patients or clients.
Recognizing the time and wanting to express really deep appreciation and gratitude for this really important talk, and for those of you who need to go, welcome to sign off. I don't know if speakers want to stay available for any additional questions, but I just want to name the time that we should look at wrapping up.
I can stay available for a few more minutes. I just want to comment on the question about clinicians have very limited time to focus on screen time, but maybe we need to schedule regular follow-up visits like we do to follow obesity or other chronic disease. My answer is yes. I think that really is that important of a consideration at this point.
Hi, I just had a few questions. Again, some of us who've been around a few years here, you know, we know over at Stanford that they were training the psychology and neuropsychology, that Facebook and them were just, you know, hiring all those people. So people that are very well trained are working at the places. So it's not like we're working just to this. It's not just happenstance that the kids are getting addicted. That was part of the training, and you know that Facebook was looking for. And I mean, the other thing I had question was, I mean, I think it just shows the psychopathology of this, you know, the screen addiction is that I work with, now I used to work for Kaiser, now I work for School Health Clinics of Santa Clara County. We have a very hard time getting the families and the kids to use their phones for medical stuff, you know, for appointments, for TAVs, for video visits, for screeners, all these things that we really want to use the smartphones for. It's hard to get them to do that. I know maybe we need to make it more well, not we, but in general, somebody needs to make it more appealing. But here you have this paradox. On the one hand, they're getting addicted to the screen. On the other hand, they won't use it.
So I think I would start by saying that there can be, I think this presentation skewed towards screen time is bad. And in many ways, it really is a negative thing, but there certainly can be some positive aspects to it too. And you're right, it would be nice for youth to use health apps, for instance, in a positive way. That could be positive utilization of screen time. I think I can't really comment on, you know, what they did at Stanford over the past decade, but it is interesting that Facebook has been saying really up until the Instagram was that, well, I think can't recall if she was Instagram or Facebook employee, but the whistleblower for the Facebook organization, before she revealed the data, Facebook was essentially saying for the past 15 or so years that there's no such thing as negative screen time. It's all positive. There's no real concrete data to support that, that there can be a real problem with screen time in whatever capacity. And they were basing that off of a study at Oxford that was actually funded by Facebook. So unfortunately, I think we're going to realize maybe in a couple of years that the sort of impacts of of screen time in the way that we haven't really regulated it, you know, on a legislative level, all the way down to just being a parent and regulating as a parent, that this can almost feel like big tobacco in a lot of ways, the amount of harms that we're actually seeing.
Right, but almost like, I mean, I don't know, parents could do a civil lawsuit against Stanford, like Dr. BJ Fogg. I mean, great guy, but he knows how the people were using what he was teaching them. And so, I mean, Stanford wouldn't let us go into like a pulmonary department and design a study that's going to hurt the lungs. So why do they let them do research and work that's going to hurt the brain in this manner?
Yeah, I can't comment on the actual studies. Not familiar with honestly, all the studies that may have been at Stanford over the past decade, but I think there's a chance that maybe some of the studies and research that's been conducted would feel a lot different in 2021 than it did in 2010, based on what we now know.
No, I don't think so. I remember 2010. We had the same conversation 10 years ago and 15 years ago. So yeah, I mean, now I guess because we have the whistleblower at that, but I think it would take some good civil lawsuits, some strategic civil lawsuits, to help affect how people are trained to do the software and run their work to manipulate our brain.
Might be on something. I am going to hop off here. I think Dr. Lopez is as well. I think we both have some patients to see here. I just want to say thank you again for having us. I think it's been a very, I hope it's been a healthy and sort of productive Q&A that you feel like we've been having.
Thank you very
so
much, everybody. Yeah.
All right. Take care, everyone.